Ever since new guidelines about breast cancer screening were released a couple months ago, a lot of women are questioning whether or not to get mammograms. Debbie is trying to clear up all the confusion.
Yeah, there has been confusion. That recommendation came out about a year ago. We have Dr. Parkinson here with us now from Intermountain Medical Center, Breast Care Center. So the recommendation came out a little over a year ago that women did not need to get mammograms, until after 50?
Well, actually, the recommendation, the most recent one came out in November of 2008 by the United States Preventative Services Task Force.
Okay.
And what they recommended is that women between 40 and 50 do not necessarily need to be screened, and that women 50 and older be screened only every other year, and that women 75 and older do not have to be screened at all.
And this caused a huge outrage. I remember when this happened.
Oh, it has caused a great deal of confusion. And the thing that is encouraging is that most major medical societies, the American Cancer Society, the American College of Radiology, American College of Surgeons, have all determined that it is best to keep the old guidelines, which are that women should begin screening mammography every year beginning at age 40.
Okay.
Because to not do that will increase the cancer deaths. Even the United States Preventative Task Force said that if they didn't screen women between the ages of 40 and 50, it would result in more deaths. But they felt it may not be worthwhile because the harms of mammography might outweigh those benefits. But this is the thing we have to bear in mind, that in order to prevent one death in the 40 to 50-year-old age group, we have to do 1,900 mammograms. Well, if you look at, for instance, the state of Utah, if we did not screen the women between the ages of 40 and 49 in our state, we would have an additional 109 deaths from breast cancer.
That's a lot of
deaths.
That's
huge.
That's
and
huge.
If you look at the whole country, that's 12,000 women, which is 4 times the number of women who died, or people who died in 9/11 a year.
Still, the fallout has been pretty significant. You have seen fewer women coming in to get them.
And what we've seen is that when women do come to the breast center for the screening mammogram, they'll say, do I really need this? I'm confused. We've had women who have called about their appointments and said, you know, I don't need to come in because I heard that report that I don't really need to come in until I'm 50. Or
and what do you say to them?
We say, disregard those guidelines. What you need to do is stick to the old guidelines, begin your screening at age 40. If you have a family history of breast cancer, premenopausal, begin your screening 10 years before the age at which your first-degree relative was diagnosed with breast cancer.
Oh, interesting. Okay, 10 years before they were diagnosed. Okay, and then you should have a doctor that you trust.
You should have a doctor that you trust. You should have an annual breast examination by your doctor beginning at age 40. You should continue to do self-breast examination, and then, as we've said, you should start screening. Now, if you're extremely high risk, you may be a candidate for breast MRI. That's something you should ask your doctor about.
Okay. Dr. Parkinson, thank you so much for joining us. And you're with Intermountain Medical Center, Breast Care Center.
Thank you.
Thank you very much. Ron?
Okay, up next, more from the